1, the second part of governor vessel points. GV9, 至阳. 至 means utmost or extreme. This point is located in the depression below the spinous process of the 7th thoracic vertebra, between left and right bladder 17 膈腧. The back of the body belongs to yang. The area of the back below the diaphragm is yin within yang, and that above the diaphragm is yang within yang. The point is in the region belonging to yang within yang, so it is called 至阳, extremity of yang. Location in the upper back region, in the depression inferior to the spinous process of the 7th thoracic vertebra, T7, on the posterior median line. Location method. With the patient prone position and the arm beside the body, the point is located at the level of the inferior angle of the scapula in the depression below the spinous process of the 7th thoracic vertebra. Indications. First, jaundice, distension and pain of the chest and hypochondria. Patients with epigastric pain may find a tenderness point here. Second, cough, panting. Third, stiffness of the spine, back pain. Manipulation, needle obliquely upwards, half to 1 寸. GV12, 深柱. This point is located in the depression below the spinous process of the 3rd thoracic vertebra, in the center between the two scapulas, like a pillar up to the vertex, down to the lower back, supporting the weight of the two scapulas. Thus, it is called 深柱, body's pillar. Location in the upper back region, in the depression inferior to the spinous process of the 3rd thoracic vertebra, T3, on the posterior median line. Location method. With the patient prone position, the point is at the intersection between the posterior median line and the horizontal line of the medial end of the spine of the scapula, in the depression below the spinous process of the 3rd thoracic vertebra. Indications. First, fever, cough, panting. Second, infantile convulsion, depressive and manic psychosis. Third, back pain, manipulation. Acupuncture, needle obliquely upwards, half to 1 寸. Perform warming moxibustion until the skin turns slightly red to strengthen the body and promote health. A 50-year-old woman used to felt ice cold from back, chill in heart, and had cold limbs for 4 years, accompanied by insomnia, sweating, and poor appetite. Various treatments has no obvious effect for her. Diagnosis: excessive yin syndrome. Treatment: apply ginger-separated moxibustion on GV12, 深柱, twice a day. After 2 times treatments, the cold feeling from back was relieved and no more chill again. After 5 days, 10 times treatments, no more cold. Then give moxibustion once a day. After totally 2 weeks treatments, she was cured. The patient was followed up for 2 years and no recurrence was found. GV14, 大椎, intersecting point of the 6 yang meridians and the governor vessel. It is located in the depression below the spinous process of the 7th cervical vertebra, the largest vertebra. Thus, it is called 大椎, great vertebra. Location in the posterior region of the neck, in the depression inferior to the spinous process of the 7th cervical vertebra, C7, on the posterior median line. Location method. With patients in the prone or sitting position, with the head bent, the most prominent site on the posterior aspect of the neck is the spinous process of the 7th cervical vertebra. It is the vertebra that moves when the head rotates, bends, or extends. Indications. The governor vessel is the convergence of all young meridians. It treats disorders throughout the young meridians. First, febrile diseases, steaming bone fever, night sweat, malaria. Second, cough, panting. Third, depressive and manic psychosis, epilepsy, infantile convulsion. Fourth, painful and stiff neck. Fifth, urticaria, acne. Manipulation. Acupuncture first, with the patient prone position, slowly needle perpendicularly 0.8 to 1.2 cun, without using strong lifting or thrusting technique. Then lifting it to the subcutaneous layer, kneading toward the acromion on both sides at an angle of 25 to 40 degrees, or needle obliquely toward the medial border of the scapula, 0.8 to 1.2 cun, to induce the needling sensation to radiate to the shoulder and arms. Second, bleed with a 3-edged needle. Moxibustion. Warming needle moxibustion, mild moxibustion, or medicinal moxibustion may be used. Scarring moxibustion may be done once a year to strengthen the body and promote health. A 17-year-old young man had suffered from high fever for 3 days. 3 days ago, he got a fever and felt cold all over the body, with hot skin and a headache as his syndrome. Then he was diagnosed as upper respiratory infection by the doctor. After taking compound aspirin, his high fever was not retreated. The details of his accompanied syndromes are weakness of the whole body, poor appetite, yellow urine, and dry bowel. His face was red, with congestion of throat, red tongue, thin white coating, as well as floating and rapid pulse. Treatment: bloodletting cupping therapy on GV14 大椎 and bleeding at bladder 2 传竹. After treatments, his fever has been kept down. GV15 哑门 intersecting point of governor vessel and yang wei mai. Ya means muteness. One of the indications of this point is aphonia due to the flexidity of the tongue. This is an effective point for treating loss of voice and the inability to speak. Therefore, it is called Yamen, the gate of muteness. Location: in the posterior region of the neck, in the depression superior to the spinous process of the 2nd cervical vertebra, C2, on the posterior median line. Location method: with the patient tilting the head slightly downward, the point is half cun above the posterior hairline on the posterior midline. Indications: first, aphonia, speechlessness due to the flexed or stiff tongue. Second, depressive and manic psychosis, epilepsy. Third, headache, painful and stiff neck. Manipulation: acupuncture, needle perpendicularly or obliquely downward, half to 0.8 cun. Precautions: take special care when needling this point. The maximum needling depth is 1.5 cun. Stop puncturing when the needle arrives at the outer layer of the dura mater. Do not needle obliquely upward or toward the nose. This is to avoid the medulla, which is central to life. If the patient experiences numbness and electric-like sensations, withdraw the needle immediately and do not lift, thrust, or twirl it. Cone moxibustion is forbidden at this point. GV16 feng fu, intersecting point of governor vessel and yang wei mai. Fu means house. This point is located in the depression 1 cun above the midpoint of the posterior hairline, which is the gathering place of the winged pathogen. The point is indicated for all types of disorders caused by wind, and so it is called 风府 wind house. Location: in the posterior region of the neck, directly inferior to the external occipital protuberance, in the depression between the trapezius muscles. Location methods: with the patient seated and head tilted slightly downward, push superiorly from the midpoint of the posterior hairline to the occipital bone to find the point. Indications: first, 太阳 wind invasion, headache, quivering with the cold, sweating, and other externally contracted diseases. Second, stiffness and pain of the neck, dizziness, nasal obstruction, nasal bleeding, sore throat, aphonia due to stiffness of the tongue, other disorders of the head, neck, and 5 sensory organs. Third, stroke, depression, mania, epilepsy, other mental conditions. Manipulation: acupuncture. Ask the patient to sit propped on the elbows with the head tilted slightly downward to relax the neck muscles. Slowly needle half to 1 cun toward the mandible. Moxibustion: mild moxibustion with moxa stick for 3 to 5 minutes. Precautions: needling depth depends on the neck circumference of the patient. Once the patient experiences numbness and electric-like sensations, withdraw the needle and do not manipulate it. There are 2 sensations of obstruction when the needle is inserted deeply. One is when the needle penetrates the neutral ligament, after which there is a sense of emptiness. The other is when the needle is at the dura mater. To prevent possible injuries to the medulla and to life, do not needle deeply, perpendicularly, or obliquely upward, or pierce the dura mater. It is forbidden to excessive lifting, thrust, or twirl the needle. Cold moxibustion is forbidden here. So much for the second part.